Good morning, everyone. Welcome to the San Francisco Interfaith Council Weekly Online Briefing for Faith Leaders. Dr. Tomas Aragon, Health Officer for the San Francisco Department of Public Health. My name is Chris Zinbanif with the JIC of the San Francisco Emergency Operations Center, hosted by San Francisco Interfaith Council and supported by Joint Information Center of the San Francisco Emergency Operations Center. Some housekeeping items and to be mindful of. The meeting will be recording. Audio, video, and chat will be monitored and recorded for record keeping, training, and quality assurance. By default, all participants will be muted and video turned off to minimize distractions. Chat is available for direct message to the community branch host of this event. We are announcing City Test SF. Anyone who lives or works in San Francisco experiencing COVID-19 symptoms can get tested. For more information, go to sf.gov/citytestsf. If you don't have internet access, you may call 311. We are also announcing San Francisco is open for business. Come out, support your local businesses. Restaurants and bars that serve food can now open for outdoor dining. These businesses can apply for the #SharedSpaces program for no cost, expedited permits to share public spaces like sidewalks, streets, and parking for outdoor dining. sf.gov/sharedspaces or #reopenSF. When eating out, please wear a face covering when not eating or drinking. No large group tables unless in the same household. Sit 6 feet from other tables. To learn more information, go to sf.gov/sharedspaces. Welcome again to the SFIC Weekly Online Briefing for Faith Leaders. I will now hand it over to Michael to begin the presentation.
Thank you very much, Chris. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this morning's online briefing for faith leaders. To ensure their congregants would be shielded from contracting the coronavirus, faith leaders quickly transitioned from congregate prayer in their houses of worship to online services and virtual ministry. Reports of serious COVID-19 outbreaks traced to religious worship services, funerals, choir rehearsals, and other fellowship occasions amplified concerns and catalyzed county health officers to minimize the contagion by issuing health orders restricting congregate religious gatherings. The Centers for Disease Control and Prevention, as well as the California Department of Public Health, issued guidance for the reopening of houses of worship and religious services, which, along with precautionary measures outlined by a number of our judicatories and communities of faith, were taken under consideration in the San Francisco Health Directive dated June 13th, 2020. San Francisco Health Officer Dr. Tomas Aragon will review the process, rationale, key points, and legal impact of the Health Directive at today's online briefing for faith leaders, hosted by the San Francisco Interfaith Council in collaboration with the Emergency Operations Center's Joint Information Center. And now allow me to welcome Kaushik Roy, Chairman of the Board of the San Francisco Interfaith Council.
Thank you, Michael. Good morning, everyone. On behalf of the Board of Directors, I just want to very quickly thank all of you for joining us this week again. And I do, with all sincerity and earnestness, want to, on behalf of the board, give a special thank you to this morning's special guest, Dr. Aragon. The breadth of your responsibilities right now and what your schedule must be like, we can only imagine. So we are truly appreciative that you've taken the time to address us this morning. So thank you very much for that. Especially for those of you who may be joining us for the very first time, welcome. At the beginning of each Interfaith Council event, we do have a brief interfaith statement we like to read, so I'll go ahead and do that now. This is an interfaith community. whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other that we might better understand the multiplicity of faith traditions in our city and in our world. Good morning, everyone.
Thank you, Kaushik. Offering this morning's prayer is Pastor Elizabeth Eckdale of St. Mark's Lutheran Church. Pastor Eckdale has been very generous and gracious, as has the St. Mark's community, to host the San Francisco Interfaith Council monthly breakfasts, as well as our Interfaith Winter Shelter and our board meetings. And we just want to say a special thanks to St. Mark's, and we welcome Pastor Elizabeth to lead us in prayer.
Thank you, and good morning, everybody. It's an honor to center this time in prayer and acknowledging the gift of this day and the gifts of all people gathered here. I'll begin with a centering prayer that my spiritual director leads me in every time we meet. And I'll pause for a brief few seconds of silence and then lead us in prayer. Let us let go of the day that is already past and come into the present. Let us open our hearts, our minds, our bodies, and our spirits to the work and presence of the sacred Spirit who guides and directs us. God with us, you embrace and love those who cry out to you. Lift up all whom hatred has cast down. Embolden those who need courage to speak and act against oppression. Sustain those who are weary from efforts that seemingly bring no end to injustice. Comfort parents weeping for children, children who have been separated from parents, and families in crisis of any kind. Restore hope where it has been lost, so that all may trust your love that reaches to the depth of pain and suffering. God, our refuge and strength, you have bound us together in a common life here in San Francisco. In all our questions, uncertainties, conflicts, help us to be with one another without hatred or bitterness, to listen for your voice amid all the competing claims around us, and to work together as a faith community with mutual forbearance and respect. Bless this time this morning, the wisdom that will be shared with us, and give us the courage to act. In your holy name we pray. Amen.
Amen. Thank you, Pastor Elizabeth. Friends, it is a great privilege to welcome today Dr. Thomas J. Aragon, the health officer for the City and County of San Francisco. Dr. Aragon, I want to let you know that from the outset of the pandemic, the San Francisco Interfaith Council has been conveying your official communiques aggressive recommendations and public health orders and directives. And they have been very, very helpful to our faith leaders in San Francisco. In addition, where there has needed to be clarity, we have gotten it. And I want to take this opportunity to commend our faith leaders for so quickly pivoting to online worship as well as virtual ministry. I know this has been a challenge for a number of our communities of faith, most especially those who are sacramental based, but it has been a new frontier for others. I think the one thing we all have in common is concern that our congregants not contract this disease, and we want to protect and care for them. Your presence here today will be very, very enlightening and illuminating, I know. And I would like to turn the floor over to you, Dr. Aragon, to help us get some clarity regarding the most recent health directive, but as well as everything that has led up, giving us a sense of process, rationale, key points, legal impact, and the like. So the floor is yours, Dr. Aragon.
Thank you very much. I'm going to put up my slides. Okay. Good morning, everyone. My name is Dr. Tomas Aragon. I'm the health officer of the City and County of San Francisco. I'm also a San Francisco native, born here and grew up in the Mission District. I attended St. James Elementary School and I attended Archbishop Riordan High School. And one of my sons graduated from Sacred Heart Cathedral Prep, just to give you a little bit about my background. My training is in internal medicine and in infectious diseases. And never in my career did I imagine that I would be in this role. So this has been a real challenge for all of us. I'm going to give you an overview that I presented to the Health Commission, adapted for this audience, and give you a little bit of rationale of how we're trying to move together safely as a city, and hopefully you'll see the rationale of how we're trying to do it. Let me go forward. Just a quick update. As of right now, we've done over 100,000 tests in the city. We have close to 3,000 confirmed cases of COVID-19. We have 47 deaths, and about 60% of the deaths have been in males. This is as of yesterday. The next slide. Let me see if I can get this to go. There we go. So the next slide is the cases, and this is what people usually talk about, flattening the curve. We went into shelter in place on March 17th, and New York City they went a week later. The state went about 3 days after us. And one of the things we learned about this virus is that this virus spreads incredibly fast. When you're not doing interventions, the doubling time could be every 3 days. And so you can imagine you have this invisible iceberg just growing every 3 days, and then all of a sudden it just comes up, and at the tip of the iceberg are all these people who are hospitalized in ICUs, mostly people who are older and people that have medical conditions. So it's a very unforgiving, relentless virus. And it's taught us so much, and there's a lot of things that we've never seen a virus like this. If you think of the conventional wisdom when this first came out, all the scientists, all the epidemiologists, all the public health people had it wrong, because we learned a lot more. And I'll mention some of those. So those are cases. Oops. These are the hospitalizations. It's hard to appreciate because this is just the most recent data. And you can see that the hospitalizations continue to go down. This is actually the best data that we have. It's the most reliable data. The case data happens to be driven by partly by testing, but this is the most reliable. And we continue to go down. And I'll explain it to you a little bit more about some key parameters that we're looking at. So one of the parameters that we look at is what's called the effective reproductive number. On average, how many new cases are produced by an infectious case in the population. When it's less than 1, That means the virus, a person is not on average is not creating a new case, but less than a case. That's great. That means over time the epidemic will be going down. When it's above 1, the epidemic will grow on itself. So less than 1, think of a negative feedback loop. Greater than 1, a positive feedback loop, and it can grow very, very dramatically. And so here you can just see throughout California what's going on in other states. And here you can see some areas that are close to 1.5. The natural reproductive number of this virus can be up to about 3.5. So, and that's one of the reasons why it can spread very, very quickly. The majority of persons do not have symptoms. And so you don't know, you can't even see it. You can't see it growing. And that's one of the real challenges. Right now, you can see that we're, based on this model, we're close to 1. So we've done better than most places in California in spite of our density. We're the second densest city in the United States. And here's overall. So if you look here, you can see that our cumulative death rate is 5.1 per 100,000. If you go down to New York City, which went into shelter in place a week after us, you can see that it was 261 per 100,000. That's 25 times more than San Francisco. And if you read the stories in New York City of what it was like, they were at a point where they were having close to 1,000 deaths a day. That's how devastating this virus is. It is absolutely, it is a very, very, very scary virus. And we're seeing this right now. We saw this in Italy. We're seeing it right now in Mexico, where if you don't have sufficient interventions, and one of the things that we learned, hours matter, days matter. You have to move quickly. You cannot waiting a day can make a big difference, because this virus spreads so fast. It's much more infectious than influenza. So, and here's a challenge that we face. So we have some really amazing mathematical modelers at UC Berkeley School of Public Health, Dr. Maya Peterson, who have fit model to our hospital data and then have taken a very rigorous approach to really try to understand different scenarios that can happen. So it's hard to see, but this is our hospitalization curve. And here we're doing a simulation, imagining that the reproductive number goes up to almost 1.3. If you can see the reproductive number goes up to 1.3, here's 1.4, you can see that we can actually tip into exponential growth. And that's why we're very concerned. It takes, from the time you make a change in a public policy, it takes really up to 4 weeks to see the impact of that change. And that's one of the reasons why we're spreading things out and we're not moving too fast, because we don't want to be in that situation where we have this positive feedback loop that you cannot turn off. Once you have thousands of people infected, none of us can uninfect them. That's the challenge. I can always roll back a health order. I cannot uninfect thousands of people. And that's really, that's what scares public health authorities. And so, and this is what we're stuck with. And the virus doesn't recognize businesses. It doesn't recognize, to the extent that I know, it doesn't recognize religious beliefs, political beliefs. It is an equal opportunity virus, and it will infect anybody. So the approach is, we start off with the state resilience roadmap. There is an economic recovery task force that represents over 100 stakeholders from across the city, including labor, businesses. We've taken an incremental approach with looking at our health indicators, spreading things out. The economic recovery task force took a risk stratification model that was developed at Johns Hopkins and then applied it to the different sectors that were allowed to open up based on what the state allows, and then sequencing them, starting with the lowest risk to the higher risk, and then spreading them out so that we have enough time to look at the impact of our interventions. If we open up too much, we may get in trouble. We don't want to get into that positive feedback loop. whatever we do, we want to stay below 1, because if we stay below 1 while we open up, we know that we have a negative feedback loop, and that's going to keep us safe. So that's really critical. To the extent possible, we try to coordinate with the region. And so the time intervals get by us 2 things. One is the ability to monitor the impacts of what we've done. And also, the longer you wait, the more time you give that negative feedback loop to push down the prevalence of active infection in the community. So an activity a month ago done today, the risk may be completely different. It may be the exact same activity, but today would be a lot less risky than it was a month ago, because the prevalence of active infections in the community were higher a month ago, and it's lower now because the reproductive number is less than 1. So to the extent that you wait, you don't rush into it, you're actually buying safety for your congregations. That's really critical. You don't want to rush into this. And then, of course, we're balancing values like equity and equality. And then, of course, there are the trade-offs. So I'm briefly going to just take you through the state framework. So right now we're in stage 2. Stage 1 was about preparation. Stage 3 is higher risk workplaces. And what you'll see, what the state did is that the state actually took activities that were in stage 3 and is saying, okay, counties, you can open them up in stage 2 if you want. And that initial movement into that was really focused on the rural counties in California that have very little infection and very few deaths. And so it was reasonable to make it available to those counties. The more urban areas are more cautious because we don't want to get into trouble. So we don't want to rush into some of those items in stage 3 unless we believe that we can do it safely. Sorry. So the Economic Recovery Task Force took the Johns Hopkins model. They look at different activities. There's a very long spreadsheet. I'm only just showing you just a first few rows, looking at contact proximity, contact length, contact volume, difficulty to social distance, difficulty to disinfect. They developed a contact risk score, a modification score, and then they did a ranking, and then we spread them out. And pretty much that was the process that we used. And as we have more things available to us, we'll continue to repeat this process. And so you can look at the current version of the reopening plan here at this website. I've already mentioned our stage 2 gating. We're now applying for what's called variance. We pretty much have opened up everything that the state allows us to open up. Not completely, but we've started to open up everything that the state allows us to open up, and we want to be able to access other activities, other businesses, other sectors that we feel that we want to be able to look at to see whether we can open them up safely. The other thing I want to just quickly remind people, this is a concept that folks forget about, is that the way to think about risk of infection is that you have to think really about cumulative risk. So if you have 1% of active infection out there in the community, and you interact with that community, let's say in a healthcare setting, let's say you were interact with let's say that could be a patient, a 1% probability that the patient in front of you has COVID. After 60 patients, you have a 45% cumulative probability that one of your patients would have been COVID positive. So the cumulative risk of being exposed actually aggregates really quickly. And this is one of the reasons why people become infected, is because they tend to focus on the per event risk. And you really have to think about what is the cumulative risk. The cumulative risk could be an individual or it could be a congregation. The risk factors for infection that as we're moving forward and we want everybody to think about is contact, distance, duration, and ventilation. Contact, distance, duration, and ventilation. Risk factors for complication, I've already mentioned. And so then this gets to the issue of gatherings. So the whole issue of gatherings from the state perspective, are really in stage 3. Gatherings is one of the highest risk activities that we can do. The state is now starting to loosen up. It loosened up with gatherings for religious services recently. And for the state, they were saying for if the counties feel comfortable, religious services, 100 people indoors or 25%, whichever is less, practice precautions, you can open up. In San Francisco, after we reviewed this with our city attorney, we realized is that in San Francisco, in order for us to be on solid legal footing, whatever we allow one group, we have to allow to everybody. We have to allow to everybody. And so there's no way that San Francisco could all of a sudden jump and say, we're going to allow 100 people indoors across the whole city all at once. And so we had to figure out, okay, how do we start? How do we begin to let this happen? But we begin to do it in a way that's going to be citywide, accessible to everybody. So this is the issue of equality, but do it in a safe way. So we started with the concept of things that are done outdoors are safer. Things that are done indoor are much higher risk. And so we're starting with 0 indoors, 12 outdoors. And as we move forward in the coming weeks, you're going to see that that's going to start scaling up. We're going to start allowing things indoor. The outdoor will always be a little bit higher, and that's going to be moving forward. The thing to remember is that this is going to be available to everybody in the city, not just to religious gatherings, but any type of gathering. And I think that's an important thing for people to recognize. We're treating everybody the same. And I know it can be frustrating because I know some people want to go ahead and just immediately implement the state guidelines. And I'll just quickly tell you, I'm going to just cover why that's a challenge. So I mentioned those core things that you have to think about. Contact distance, duration, and the last category. So as you begin to design your systems to open up, with those 4 factors that were in the previous slide, there's things that we absolutely need everybody to think about. Face coverings, physical distancing, hand washing, and testing. So you want to take those 4 principles and these 4 practices, put them together, and that's how you need to design everything. We know so much more now about this virus than we did before. We know that on average of the people in the community that are infected, half of them do not have any symptoms. When you speak, you're not only putting out droplets, but you're putting out aerosols that stay suspended in the air nearby you for several minutes. If you speak louder, you put out more aerosols. If you sing, you're putting out the tiniest aerosols that will be in that enclosed space for many, many minutes. That's why enclosed spaces are it's very dangerous to be inside enclosed spaces. And that's why as you begin to design what you do, you have to really think about all of these things. How are we going to do the face coverings, the physical distancing, making sure the hand washing? How are we going to make sure that things are ventilated? Are we opening the doors? All of these things have to be carefully designed. And then you have to think about, do we have people who are vulnerable that are going to be coming together? In general, it'd be better for the vulnerable people not to be there because, like I said, you cannot uninfect people. When you're in an indoor space, one person can infect dozens of others. So indoor space is incredibly, incredibly dangerous. And so you have to think about how you begin to do this safely. And remember, as we begin to open this up, we're going to open it up for all of San Francisco. So that's why we're moving incrementally and cautiously, because we don't want to tip ourselves into a place where we can't reverse. And the other thing I tell people is to remember that this is temporary. You know, hopefully next year at this time, we're all going to be getting vaccinated, and we're going to hopefully be moving back to the old.
give us a second while we help Dr. Aragon get back online.
Okay, sorry, can you hear me?
Yes.
Oh, I'm so sorry. My computer just crashed right when I was at the last one. So maybe what I can do is I think I covered the most important concepts. I want to go ahead and give time for questions. So we want to move. Is it okay if we move to questions?
That'll be fine, Dr. Aragon. And I did want to tell you that with your permission, we would like to include the slides with the recording of the link today.
Absolutely, yes. Why don't we do that? And as I answer questions, if there's anything that I skipped, I'll just go ahead and just
We have
mention.
about another 5 minutes or so if you need to take, if there were some salient points that you really felt that you needed to make before questions, I think this would be the time to offer it.
Okay, well, let me just take a little quick look here.
Okay.
Can you enable my, go ahead, if I have 5 minutes, I'll go ahead and take advantage of it. So
Okay.
go ahead, if I can share.
Take 10 minutes if you'd like.
Okay, let's do the share. Can I share the screen? I mean, yeah, you'll have to unlock me. There we go. Let me just, let me open this up. Hang on a second.
We are people of faith who prayed for your return.
Yeah, that was, yeah, it's funny, it just, my computer just completely just crashed. Oh, you know what? That was actually the last slide. So let me just make sure I, and so so that's what, the key thing I want to have people know about is that we're all moving together in terms of gatherings. So that's a really key concept. We're starting with outdoor versus indoor, and then we're going to start increasing both. Everything will be citywide. So it'll be all together, whether you're getting together for a religious service or a religious reason, or you have a social reason you want to get together. And so that's one of the reasons why we're starting off with a smaller number. But in the next several weeks, this will be increasing. It's just that we're going to be doing it citywide. And then on our end, the city's focusing on increasing our testing capacity, putting in a good surveillance system for the city, doing our contact and case investigation. And then what we come out with, one of the ways San Francisco differs from the other counties, some of the counties are getting themselves into trouble because what happens is that when the state says you can do something, the county says, go for it. Go get those guidelines, just go for it. We're taking the state guidelines, the CDC guidelines. We're looking at the core standards that we have here in San Francisco around minimizing infection. And then we're writing directives and best practices, and then working with the different stakeholders to help them implement it in the safest way. So it takes longer to get things up and running, but we think it actually makes a big difference if people don't just rush and just start opening things up. We make sure that people have a plan, that they really have thought through the implications of how they're going to open up as safe as possible. Nothing is risk-free. But we think that if we keep the prevalence of active infection as low as possible, then it's going to be easier for us as a community to manage the risk. And that's really important. If we let it go out of control, then it becomes really difficult. Then that gathering that you did last week may not be safe this week if the infection is out of control. And so if we all work together, we all work together, I think it's going to make a big difference, and it already has made a big difference. And so that's something I wanted, in ending, I want to just express my gratitude to the amazing work that everyone's doing, to your cooperation, to your supporting your constituents and making sure that they're safe and that they continue to be safe. This is temporary. We're going to get through this together. And hopefully next year, I'll be here speaking about the vaccine and how we're all doing amazing. So let me just stop there and then open it up for questions.
Thank you very, very much, Dr. Aragon, and for so gracefully picking up where you left off. We have invited 3 what we call faith panelists from different faiths who are really at the core of oversight, if you will, for their particular jurisdiction. We've asked them to share with you a little bit about their demographics, their geography, and the preparations that they put into reopening, as well as to ask a question of you. We're going to begin with the Reverend Canon Abbott Bailey, the Canon to the Ordinary for the Episcopal Diocese of California. Abbott?
Good morning. It's really good to be here, and thank you, Dr. Aragon, for your presentation. It was so helpful and so clear. As Michael said, I'm the canon to the ordinary for the diocese, the Episcopal Diocese of California. That covers the Episcopal congregations in the Bay, throughout the Bay Area, about 78 congregations, and 17 specifically here in San Francisco, as well as some Episcopal social service institutions. Canon to the ordinary, I'm something akin to the bishop's deputy, and am helping to manage and coordinate the COVID response throughout the diocese. So we have been receiving the local and state guidelines as they have come out, and have been digesting them, and in some cases where necessary, interpreting and then putting out our own protocols based on those out to our congregations. And about oh gosh, 2 weeks ago, I think, was when we released the first iteration of our reopening guidelines for in-person worship. And of course have been tweaking those along the way based on local, and now we have San Francisco, so those have been updated based on that as well. We are requiring regathering plans from each of our congregations. They will submit them to us, and then once we receive all of the plans for the entire county, all of the churches in the Episcopal churches in San Francisco, then we will be considering pushing go in terms of implementing those plans. Some of them have started rolling in, and interestingly, a number of congregations are choosing to continue with their online worship for the time being, until perhaps until the size of the gathering can increase, and other types of factors. But so those plans are rolling in, and Bishop Mark Andrus has, again, those will be implemented, but no sooner than June 28th. And we continually let folks know that there might be a little bit of a lag time between when the local health ordinances come out and when we push the green light, so that we can make sure that we are doing this safely and effectively, and really in line with those guidelines. And I just want to say, thank you. All have been on this from the very beginning, and in conversations with colleagues around the country, we're in a little bit of a different place in that we are receiving very clear guidelines based on data and science from our local health authorities. And it's made our work certainly easier in that regard, and we are very, very grateful for that. So thank you very much.
Thank you.
Gosh, there are so many questions to ask. I'm hoping my colleagues here will cover some of them with me. And so I'm having trouble deciding which one, but I would say one of the big questions we're getting asked a lot is about the age guidelines. And the guidelines that you all released have mentioned special consideration for those who are 60 and older and in a vulnerable category, and being sure to communicate the risks clearly. And then there's also, how do we give special considerations? So there's a little bit of, there's the strongly kind of encouraged not to attend, and giving special consideration and making sure it's communicated clearly. How would you communicate that risk, and what would be your recommendation in terms of the age guidelines?
I think the way that I've been thinking about it is one is to provide the facts, give people the tools, and then give people options. Because I think at the end of the day, everybody's risk tolerance is different For an individual, they may feel it's worth for them. They may feel it's the activity is worth the risk to them. And so by giving people options, giving them facts and giving them tools, I think you're more likely to meet different people's needs. And so, yeah, I know it's a very challenging situation, and we're facing that with as schools open up in the fall. You know, in San Francisco, when you look at just the number of kids that will eventually be going back to school, which is total is going to be close to 80,000 kids, it's the same issue that the parents have to deal with. What are our options? What are our tools? How can we minimize risk? And so it's very challenging because there's no absolute certainty.
Okay. Thank you, Abed, very much. Our next faith panelist is Raphael Brenner, Director of Jewish Community Security. I first came to know him because we were tackling the issue of security in houses of worship. We never thought that security in houses of worship would be extended to a pandemic. So I would ask Raphael if he could kind of brief us on what's going on in the Jewish community, as well as ask his question.
Thank you very much, Michael. I suppose this falls under health security in terms of job duties. The San Francisco Bay Area is home to the fourth largest community in the United States, the fourth largest Jewish community in the United States. And I advise Bay Area Jewish organizations spanning the East Bay, North Bay, San Francisco, and the Peninsula. So I'm asking my questions and speaking on behalf of this community, not just those in San Francisco. This encompasses about 200 community organizations, about half of them synagogues or other prayer spaces. Our most anticipated and most heavily attended holidays begin September 18th this year, just 3 months away. Jewish religious services involve all of us lifting our voices in song and prayer, call and response. And this is the clincher from your presentation. We often turn to face in all directions. We follow the Torah scrolls as they move around the congregation. So it offers a real kind of garden sprinkler effect. So from your presentation, it sounds like perfect conditions for one person to spread the virus very easily. Although the Jewish high holidays are only 3 months away, it seems impossible to guarantee that it'll be safe to reopen our synagogues and prayer spaces. And I'd be eager to hear what your calculations or crystal ball says about the level of risk in September. Now that said, from what I'm hearing from temple administrators, we're not in a hurry to reopen. Our congregations skew older. We don't want to have a return to holding in-person religious services and have that spread the virus to some of our most at-risk community members. Other community organizations are likely to take their cue from synagogues and what synagogues do. So my question is, as we move toward reopening overall, what advocacy role or what role modeling function do you see houses of worship playing?
So first of all, about the risk in September, and it's a really good question. It's an unknown at this moment. We know that as we begin to open up, we know that there's going to be more infections. So just the opening up of the economy, the mobility, all the interaction, there's going to be more infections. We're also in September, in the fall, we have kids going back to school. We don't know what that's going to do because kids are potential amplifiers of epidemics because they have very few symptoms. They can transmit amongst each other. You can't see that the infections are happening, and then they go back and they infect households. And so we know that from influenza, children are big amplifiers of infection. We're also going to be moving into our respiratory virus season, which we usually call the flu season, but the other respiratory viruses that are increasing. And so we expect a wave just to happen because of that. So all of these things are going to be happening at the same time. So then the question is that the risk is probably going to be higher in September. And it is really hard to manage the risk because the only way you could really do it is if you were actively testing everybody on a frequent basis. So that you'd have to do massive testing on a frequent basis to make sure that everybody that's in the building at that moment in time has the lowest probability of being infected. And that's usually not a practical solution. it would be for a small group of people. You're seeing this with the professional sports that are going to be playing without spectators. They're going to be testing their players every 10 days. They're testing them to make sure that the people who are on the field are not carrying the virus and don't have an active infection. That would be really the only way to manage that risk, but that's not a very practical way. So hang in there. Whatever you decide to do, remember, maybe you can do streaming, I don't know, or you can, remember it's temporary. This is, hopefully this next year at this time will be a completely different, and we'll go back to other ways of doing things. So I hope that helps. Oh,
Thank
and
you.
then advocacy, last thing about advocacy. So I think the interfaith community plays an incredible role, because you can do a lot to keep your constituents safe and healthy. Spirituality is so important for mental health. And so you actually play a really big role in mental health as well, because this is really difficult times. And so people need the spiritual connection now more than ever. And so so those are really two big things that I think the community can do, both the mental health and the safety component, I think, is critical. So thank you everyone.
Thank you, Dr. Aragon, and thank you, Raphael. Let us move now to Derek Gaskin, who's the Director for the Department of Safety and Security and Risk Management at the Archdiocese of San Francisco. We've worked very closely with the Archdiocese on a number of our disaster preparedness programs as well. Derek has been a colleague of ours in our security and houses of worship as well.
Thank you, Michael. I appreciate this opportunity to share with everyone on this educational panel, as well as the attendees. If you don't mind, I'd like to get a couple of thank yous out of the way with respect. First of all, on behalf of the entire Archdiocese of San Francisco, we would like to thank Mayor Breed for her leadership during this unfortunate COVID-19 health crisis. We do appreciate the hard work and planning that continuously goes on into the day-to-day planning for the entire county of San Francisco. Also, on behalf of the entire Archdiocese of San Francisco, our thanks goes out to Michael Pappas and the entire San Francisco Interfaith Council team. We appreciate your partnership. Michael, thank you for your ongoing support, and I personally wanted to thank you for your genuine friendship. Appreciate it. Thanks to Dr. Tomas Aragon, the Archdiocese of San Francisco. Really appreciate your expertise in doing your best to make sure each precious life is protected and respected. Thanks for your unmatched dedication. Thank you on behalf of the entire Archdiocese of San Francisco. If I can, Michael, I'd like to share just a little bit about what we've been doing and where we have come. So the Archdiocese have multiple task force teams led under the direction of Archbishop Corleone. We've developed, implemented, and began training on our reopening guidelines for all parishes located in all three Bay Area counties, Marin, San Mateo, and San Francisco. The parish efforts were led by one of our well-respected clergy members, Father Tom Martin. Our parish safety coordinators meet with us each week. We talk about, each county Department of Public Health guidelines, in addition to CDC requirements and HHS recommendations, which, we also include OSHA, which is a big role player as well as in regards to guidelines, safe practices, so that each location can operate with confidence while being in compliance. We've also developed an e-plan app to help our organization mitigate and manage our guidelines during this unfortunate health crisis, which also includes contact tracing, which we refer to as tracking, simply because contact tracing is a broader term. So we like tracking better. Really the responsibility of that on our behalf is to be able to pass information on as it relates to potential exposures to the Department of Public Health. The question that I have, comes from the utmost respect, and what it stems from is we would like to have clarity as well as fairness. So I'd like to ask this question. The city of San Francisco has allowed sensitive street protests to go on without a limit on numbers and without consistent social distancing requirements, which is in violation of its own Department of Public Health orders, which also reads no mass gathering at all. It is our understanding that San Francisco Mayor Breed has told restaurateurs in opening up not to worry if they cannot get a permit in time, but to use their common sense. The city of San Francisco then has made it clear that it does not insist on strict adherence to its own health orders, but rather is urging people to use their own common sense and be responsibly safe as they emerge from shelter in place. So Dr. Aragon, with respect, is there any reason why this principle that applies to others should not also apply to religious organizations?
So yeah, the first one you mentioned is about the protesters, and I think, and this is something that everyone across the country has really been challenged with. I'm not the police department, so I really can't speak to their enforcement options. I can just tell you from a public health perspective, all of us were very, very nervous about all these protesters, especially when they're not physically distancing and they're not wearing face coverings. And we know that that's just the yelling. We know that that's a real risk of an infection. And that's one of the reasons why we opened up a special testing site just for people who were in the protests, if they wanted to get tested. And I think you're absolutely right. That's actually a real challenge. And this happens, I just, from a public health perspective, this happens occasionally. When you have really large gatherings of people that are doing things outside the law, when it's so large, it's just very hard to manage. I can't even imagine. I sympathize with the police who have to manage it from a public safety perspective, and then from the public health perspective, if you can't do it from a public safety perspective, it's really hard to get people to comply with the public health perspective. The way that I would say the approach that we've been taking around enforcement around the public health directives has been primarily using an educational approach, a supportive approach. This is the approach that we use, for example, when we regulate restaurants. Whenever there are violations with restaurants, this is just our tradition, is rather than really coming down hard on folks, we work as much as possible. How can we help you succeed? We try to educate. What resources do you need? Do you need training in your own language? We really go out of our way to really help everybody succeed. And I think in the long run that works out better because there's less friction. The Bay Area in general has been different than other areas. People have been much more supportive and cooperative of the interventions. I believe part of that reason is that people here are well informed. People read the news, they hear what's happening around the globe. They realize that this is risky and that these are just not arbitrary. So I would say the Bay Area has been better. You mentioned about the open spaces. I think that had to do with the permitting to be able to put the chairs outside. There is a permitting process. And I think what Mayor Breed was saying, okay, if your permit is in progress, just please make sure you follow the guidelines. Again, it's one of these things where it's hard for the police when you have literally hundreds potentially opening up for them to make everybody comply 100%. So they're asking people to use common sense and do things in a safe way.
Thank you very much, Dr. Aragon. Your presentation has been not only clear, but it's been authentic, and I think what you're asking us to do is really to follow the spirit of the law in protecting those who we are entrusted with their care. The other thing you lifted up, which I just want to accentuate for a moment, is the role of faith leaders in this whole process. We have been responsible, if you will, for cultivating community in the midst of isolation. And in our congregations are some of the most vulnerable members, not only those who are elderly, but those who are challenged in other ways. This pandemic is going to have a devastating impact economically on mental health. And I really believe that our faith leaders are going to not only be responsible for the cultivation of these precious souls, but also to navigate us back into community. And so I just want you to consider us partners with you in your work. And we want to thank you with much love and respect for the time that you have given us today. If there are any last words you would like, or anything that you forgot, this would be time to offer them.
Thank you so much, and we would love to work with all of you as you begin, as the size of gatherings start going up. We'd love to work with you to make sure that it's done as safe as possible, and thank you for keeping everybody safe. It makes a big difference, and so I just want to thank you, greatest gratitude.
Thank you, Dr. Aragon. And to all of those who are listening on, the recording will be made available. We might have to splice a little bit.
Sorry.
No, not at all. Not at all. So that we can make sure that, that all of the information is there. As well, we will be including your slide deck in sending this out to everybody. We want to say a very special thank you to just a couple of people, Cynthia Zambucas, the Program and Administrative Associate from the San Francisco Interfaith Council, for all she does, as well as our Emergency Operations Center, Joint Information Center team, Coordinator John McKnight, Virtual Outreach Lead, Trey Russell Allen, Christopher Sindabath, and Sharon Walton, who are with us today. We are looking forward to joining you all, having us join us next week, where we will talk about the impact of COVID-19 and shelter in place on domestic violence. We will be joined by Isha Dolia of La Casa de las Madres. It's a very important conversation, and so we hope that you all can join us again next week. Once again, thank you all, and thank you, Dr. Aragon, for this gift of time and your expertise. We look forward to seeing you all next week. This concludes this morning's program.
You're welcome. Bye-bye, everyone.